Is it important to know what kind of skin type that you are?
Absolutely, because I see a lot of IT patients, they have no sun exposure. All they're doing is having a lot of blue light exposure.
So two whole finger.
Two whole fingers.
I was doing like this much.
That's the biggest mistake a lot of people do.
I looked at the price of the sunscreen. I said, okay, little bit. Is facials needed?
If you want to relax without any I would still prefer there are something called party peels that will give you that nice glow under 5 to 10 minutes.
Party peels.
Party peels.
Very nice.
They are there. Oh, this is something that we need to talk.
Tell me more about bone broth. How do you make it? You are seeing early balding more commonly these days.
As young as teenagers coming with balding. Teenagers.
Mainly
Teenagers.
boys. So minoxidil helps in preventing hair loss.
Let me put it this way. Finasteride,
So what about hair gummies?
don't buy into it. Because
Toothpaste reducing pimples.
it will reduce the pimple, but it will leave you a dark spot, which is better.
Before we dive in, can I be honest with you? It blows my mind that 57.9% of you who listen regularly still have not subscribed to our channel. If you enjoy the podcast, the stories, the science, maybe even laugh at our jokes, could you do us a small favor? Hit that subscribe button. It takes only 2 seconds and helps us keep bringing you better guests and episodes every week. I'm truly blessed to have all your support and I'm sure you will support me in the journey. Now, let's get into today's episode.
Hi, Dr. Priyanka.
Hi, Dr. Pal.
How are you?
Good, thank you so much. Thank you for having me on Gut Feeling with Dr. Pal.
The reason I'm bringing a skin doctor is gut and skin is connected.
Absolutely. Friends.
So the one thing I absolutely love about your channel is that you food related skin treatments. I absolutely love it.
Thank you so much.
I
Thank
strongly believe that if you take care of your gut, you don't even have to see a doctor. Skin
Oh,
doctor.
no, not really, please. Not so much.
So we have a lot to cover. Okay, so I'm just going to start right off the bat.
Please.
By saying that, you talk a lot about skin types. Dry skin, oily skin. Is it important to know what kind of skin type that you are?
Absolutely, because that is the basis, doc, based on which you build your skincare routine. Imagine you are having oily, acne-prone skin and you don't have any ingredient to address the excess oil. Because this is what I see a lot of times in my practice is that patients are buying products left, right and center without even realizing their skin type. And then they come saying this product has caused sensitivity, this product has given me breakouts. That's because either it is too heavy for your skin or the product is too heavy, like blocking your pores and then leading to acne, or you have dry skin and you have exfoliated it so much, stripping the natural skin barrier and it is causing sensitivity. So it's very, very important for you to know the skin type first.
I'll be very honest with you. My wife is a wonderful analysis of skin type. Not only her, for everybody
Everyone
else.
around.
Everyone around. I myself don't know what skin type I am. Okay, all the skin type I know is whether brown, black, white.
The color.
The color. How do I know? For example, if I'm your patient, how do I know my skin type?
So I'll tell it in the most simplest way is it's not rocket science, firstly. So just wash your face with a very mild, gentle cleanser. You for that, you can just see pH balanced, gentle cleanser for sensitive skin. Those are the labels that you can see. So just wash your face, leave it for about 30 to 60 minutes and then see how you feel about your skin. So this will require a little bit of tuning into your skin, understanding how you feel about your skin, right? There are two things, visual and what you feel, two things. So if you feel after about 1 hour that your skin is feeling very stretched out, you just want to apply something, then it is mostly a dry skin. But then you have, your skin is shiny, even, after like 30 minutes or 1 hour, you feel your skin is shiny, then it is most likely oily skin type. You feel absolutely normal, like you don't even realize that you don't see any change, then you are the chosen one which has the normal skin type. This doesn't require a lot of maintenance also.
Oh, that's me.
Yeah, that's you now. That's you now, but I think you had oily acne-prone skin growing up.
No. Even now only I have them. I think so.
But I think it has gotten a lot better for you because you had, looking at your skin, I can say that you had a lot of acne growing up, but then it has calmed down a lot now. So it is not as oily as it was at some point.
Like for example, I after washing my face, I feel like something is pulling me down.
Yes. You feel that?
I feel that.
Then it's gotten dry.
Dry. Can we change?
Yeah. Tell you how the skin types change, but there's also another skin type which is combination skin type, right? So you have your T-zone, this particular portion of your face or some part of your cheeks feel shiny, but the rest of the parts of your face feel stretched, like the screaming, like wanting to apply something on your skin. That is dry parts. So that is a combination skin type. Now the other category is sensitive skin, which is not a skin type in itself, because skin sensitivity can come and go depending on what you've done or what you've not done. So sensitive skin is a different topic altogether. So you have your dry skin, oily skin, normal skin, and combination skin types. Skin types will keep changing with age, depending on what you're eating, where you're living. Like suppose you're in a very dry place, your skin tend to get more drier. If you're in a hot, humid place, it tends to become a little bit more onto the oilier side, only for that particular period. So it's mostly with age, mostly with food. Skin type can keep changing and evolving. So it's never the same.
Okay. So I'm a nice student to your reels. Okay.
Same, likewise.
So I didn't know anything about skin routine. My wife tries to teach me, and I think she gave up.
but Doc, I'm telling you, you really have a great skin at this point.
Oh, thank you.
Yeah.
Thank you. I can keep
It's
it this
nice.
way?
Yes.
Oh.
Provided you don't keep touching it like the way you're doing it now. One of the biggest mistakes people do, especially people who have acne, is touching your skin. Your phones, your hands, it has a lot of dirt, bacteria, and the more you touch, you're transferring the bacteria again back and forth. Plus, friction-related melanosis is very heavy on our Indian skin type. So we have to be causing less friction, which means minimize the touching. And with acne, you tend to pick your acne. That is again causing more pigmentation. So do not touch your face unnecessarily, only when you're applying some cream. Or if you have to just shush off the mosquito that is sitting on your skin, don't touch your skin unnecessarily.
I saw your reel and I figured out that we need to do a skin routine even just to as a maintenance. So for me, I think I have a combination. I feel shiny over here and then dry over
Dry
here.
there, yeah.
I didn't touch my skin.
Thank you.
So what should I do? Should I have to buy a separate cleanser for that?
So it depends on how contrastingly combination skin you have, right? Sometimes it's just very minor difference, and we tend to give a product that's not too thick, that's not meant for extremely oily skin. There are some products that suits all skin types. So that is the product that we tend to give for people who have combination skin without lot of active concerns. There are some people, you will not believe, Dr. Pal, who have lot of like acne, oily skin here, but extremely dryness in this. Then we definitely have to give two set of products, at least for a moisturizer, we have to give different set of product. But people who have combination skin, by and large, we tend to give products that suit.
So if a person doesn't know which one to do, they could just do like a cleanser which is good for all skin types.
No, not for oily acne prone skin. So which is why when you are a beginner at skincare, I would say one consultation at least have with your dermatologist. Understand your skin type, understand the basics of your skin. In about 2 months of you following the routine given by your dermatologist, you will understand the basics. Then is when you can try and experiment with the online trending products basis on the ingredients. You can still see now if you say do not do anything online without consulting your dermatologist, nobody is going to listen. So we have to strike that balance now. Say at least understand the basics of your skincare and then experiment. Like for example, for you also, when you're saying you know with your diet, understand the basics of how your gut is responding to each of these foods. If you don't understand, meet a doctor, understand it, and then maybe you can experiment a little bit. It's like that only. Initially understand, because now with so much of noise, so much of misinformation, it's becoming difficult for people to know what is good, what is not. So everybody has to have a skincare routine. For normal skin, I would say it is very simple. If you have normal skin and if you don't have any major concerns, do not spoil something that is already good. Just use a basic
My
cleanser.
wife's phone number.
I'm going to meet her now after this. We are going to have one-on-one chat. And be ready for your pocket to be
Yes, there's already no pocket there.
Okay, so for normal skin, just use a good cleanser, a gentle cleanser, sunscreen, moisturizer. That's all you need. Plus, if you have concerns of aging, then you can add an anti-aging serum. But otherwise, these three are your pillars for everybody.
Super. So I have started do skincare routinely in the last 3 months. Yeah, never done in my life. But thanks to my wife, she keeps on insisting that anybody should do it. Yes. So I do, as soon as I wake up, I do a cleanser. And Dr. Reshmi Shetty also told me before. And then after that, but I didn't listen to her.
You listen to your wife, you better do.
And then after cleanser, then I do moisturizer. Moisturizer, and then after that, sunscreen.
You can also skip your moisturizer and use a nourishing sunscreen in itself. Now, multifunctional products have come.
see.
So there are sunscreens that also have little bit of humectants and hydrating ingredients. So you can just make your morning skincare routine to as less as one step. Like for example, I have dry skin. I don't use a cleanser in the morning. I just wash my face with nice cold water and I feel fresh. And then I just apply, for me, because I am also into skincare, I like doing it. I apply a serum. And then before I step out, I apply my sunscreen. But if you have normal skin, if you don't want to do all this, just wash your face with water and apply a sunscreen when you're stepping out. And that sunscreen can be hydrating also. But if you have very, very, like contrasting skin that I said, then you can bring in other steps into the routine. So your skincare routine can be one step, wash your face with water and apply a sunscreen, or it can be two steps. Wash your face, apply a moisturizer, and then do your sunscreen.
So it's very clear that we can put an end to this discussion where sunscreen is needed for Indian people, dark skin doesn't matter, right? So
A safe sunscreen is needed.
safe sunscreen is needed. What is safe?
See, the thing is now with sunscreens, I think with time we keep learning. With what data we had previously, we were using certain ingredients, but now with the data that we have, which are emerging as endocrine disruptors and all, we try to stay away from certain ingredients like oxybenzone, avobenzone,
Avobenzone.
like benzophenones basically. And then there's octicrylene, which is okay with in a limited quantity, which is in a certified permissible quantity. It is still okay. But now we have a lot of new age filters, which are much more safer, long lasting. Now the sunscreen application every 2 to 3 hours is not going to be a norm anymore. Many sunscreens are long wear sunscreens where you can apply just once in a day, unless you have like full day consistent sun exposure.
How do we know? They will say long lasting, or how do we know?
No, they don't come with a label. Sometimes you can read the ingredients, but also now new age sunscreens are moving towards that.
Okay.
But even now, as still we don't know, many sunscreens are still in that category as yet or not. So it is good to reapply every 3 to 4 hours if you have consistent sun exposure, or you're like you're shooting the whole day, or you have blue light exposure the whole day. Then you must reapply. Otherwise, I apply once in a day.
Once in a day.
Yeah.
Blue light exposure is looking at the laptop throughout the day as well as a blue light exposure.
Yes,
right?
a lot. I see a lot of IT patients come with uneven skin tone pigmentation. They have no sun exposure. All they're doing is having a lot of blue light exposure, bad dietary choices, smoking, sedentary lifestyle, leading up to the facial pigmentation. But most important factor being the blue light.
Blue light. And SPF 50 plus, 60 plus doesn't matter that much?
No, it matters. I like SPF 50 to be the sweet spot. SPF 30 is also okay. Anything above 50, sometimes it's just marketing. Sometimes is going to make your sunscreen little longer lasting with very marginal additional benefit. 50 is a good sweet spot that you can stick on to. Now, PA rating is becoming also very widely published on the bottles as well.
It will say PA plus.
At least 3 plus should be there. One more plus is great. 4 plus is good. So SPF 50, PA 4 plus is good. So you're getting protection from UVB, UVA. You know that much. And now you also have sunscreens that say critical wavelength protection, blue light protection sunscreens that are being mentioned also. Now this is also giving additional protection to the visible light, blue light protection, because this is becoming increasingly increased exposure for us as compared to sun. Right? So now blue light, you can read those things on the label also saying blue light protection, critical wavelength, all of that will be mentioned.
But I absolutely love how you showed how much amount of sunscreen that you should do, right? 2 finger. I was doing like this much.
That's the biggest mistake a lot of people do.
I looked at the price of the sunscreen. I said, okay, little bit.
Dr. Pal, come on. You should not look at the price.
So 2 finger. Whole finger.
2 whole fingers to give you protection on your face and neck. 3 finger lengths if you want to also give protection to your ears and the back of your neck, especially for men. This is more important because for us, our ears are not exposed, our neck is not exposed most likely, and most females now are leaving our hair for most part. But for men especially, your ears and the back of the neck is getting exposed, so it's much more important for you guys to have that additional protection as well.
Back of the neck is for preventing skin cancer?
No, it's about, for Indians, we are inherently, do not have a lot of chances for cancers as such, right? So it is about pigmentation again. How many people we are seeing with pigmentation on the back of the neck, sides of the neck, up until your décolletage. So that is all because of sun exposure. Your age spots, sunspots also develop in these areas that is exposed. So 3 finger lengths for protection.
Okay. Just out of curiosity, I have not been doing it, but because it's only back, nobody's going to see.
sometimes it's not about nobody is going to see.
It's about
that's
how
what-
you feel.
It's about how you feel. That's why most of the people we talk about 2-finger lens. Ab itna karo bas. I mean,
I see.
you'll pun
I'm
that
not a good
or-
dermatology host.
No, but I'm telling you, I think you should thank your wife that your skin is glowing and how it's very nice. Yeah. It's
So I do that
it's
three.
got good reflectance. It's nice.
That's because of light.
See, dermat's eyes can't be fooled.
Is that right? Yeah.
We have scanners. Yeah,
No. Reshmi Shetty said the exact same thing.
Yeah?
The first thing that she does is that, how can I improve this patient's face? Doesn't matter whether he's a patient or not.
and then we zip it up. So when my patients come and ask me, doctor, nothing, I just want a skincare routine, but I want you to see and tell me what I can do. I said, never ask that question to a dermatologist. We have scanners that zzz, and we can tell you 10 things. And it's not just with you. Ourselves also, when we look in the mirror, I can scan myself and say there are 10 things that I can address, but that doesn't mean you have to address every single thing that you think can be fixed. We look at the health of the skin. That's very important. First, our job is to make your skin healthy. And then comes everything else.
Is facials needed?
If you want to relax without any actual long-term benefits, if you just want to relax, improve the blood circulation, get that instant glow that lasts for that set period, you can do it. But if you are looking at, okay, everything that I want to do on my skin has to have some benefit, then it's not necessary, because when you do a chemical peel, when you do certain lasers that boost the collagen, everything else is taken care of. So why do you need a facial unless you want to feel relaxed and get that short-term benefit? The same thing even a minor superficial laser appeal can also do.
I see.
But again, it's very like people have been doing facials for years and all these procedures are much more newer. So the comfort factor with these procedures is there. So people tend to do it. We do medifacials in the clinic. People easily are willing to do those as compared to the lasers. So when we say you can do this, the first option is, but can I do a medifacial? Okay, if that's your starter comforting thing, do it.
Because the advertisement is like, if I do facial, I become like Salman Khan.
Give me a better example now, please. Oh God. Oh God, Baijan people will come here. I mean, Salman to beauty was never the thing. No, you talk about fitness to Salman, so I couldn't relate instantly like that. But it's a overhyped procedure.
Overhyped procedure. If you have an active event, or if you're on stage, or if you're being focused on something else,
I would still prefer, there are something called party peels that will give you that nice glow under 5 to 10 minutes.
Party peels.
Party peels.
Very nice.
They are there. Priya didn't know. Oh, I should go tell her. Oh, this is something that we need to talk. So party peels are there, which under 10 minutes are going to like just give you that subtle glow, exfoliate your skin.
I see.
But again, I said, if you want that see, it's also ultimately how you feel when you get something done, right? When somebody gets some medifacial done, they're lying down for 1.5 hours or 1 hour at least. And they're getting pampered through the process. Nice music, somebody giving you a nice massage, products going in. It's a very satisfactory feeling end of the day. That is the mental health benefit is going to be added.
I see.
But nothing more deeper.
Nothing more deeper to that. But let's talk about collagen. Collagen is a important ingredient, and I'm going to argue by saying that there was a recent study that said that collagen supplements doesn't support that much in a normal skincare routine.
Yeah, I'm also not very convinced with collagen still now. But now we do have certain research papers that, because it was so far, those studies were sponsored by that particular company, so it was not very reliable. Up until now, I was also not prescribing collagen, but now I started because there are some third-party studies that are also coming saying marine and bovine collagen with certain kind of peptides are giving results. I started taking it myself. I felt subtle changes in my hair and skin. That is when I started prescribing. So it's all about the formulation, but it is also to be supported with healthy diet that you take. Otherwise, these are not going to be processed well. So it's about the formulation of the collagen, and there is nothing called vegan collagen at all. It is either through bovine or marine sources.
It's either through fish or through cow.
Through cow, yes. These are the effective sources.
US are mainly bovine.
Yes,
Abroad.
here because of some religious
reasons.
factors, many people prefer marine collagen. But bovine and marine are good, but bovine is slightly more better.
Any food that they can say take?
Bone broth.
Bone broth.
Bone broth.
Tell me more about bone broth. How do you make it? Okay, use some bone broth.
it takes hours to prepare the bone broth. It's not something that you prepare because cooking, when you asked me, Allah,
No, it takes 18 to 24 hours.
Yes, exactly. It has to be
to simmer.
slowly simmered, and all this nice peptides from collagen from the bones should seep into your soup, and the bones should become so soft that you touch and then they melt. That is the right way to make your bone broth.
So the bone has collagen that gets seep into the liquid.
The liquid that you drink, and the bone becomes so soft that you can even like chew and swallow. Some people don't like doing it. It's up to them because most of it is anyway seeped into this. But I say just have that bone also, because it has become, when you have your paya soup and if the bone is so soft, you end up eating it.
Correct.
So and you can add some condiments also in it, where you can add some spices to make it taste better. But it takes hours and hours and hours of, it's not, so you make it for a week, store it. It's not something that you do daily.
Correct.
Yeah.
We do that to break fasting. I did that when I was doing my weight loss journey. The first thing, because that doesn't have that much amount of carb source.
Yes.
So it is always better not to break the fast with carb source as much as possible.
Right.
So I extended my carb source intake by using bone broth. A lot before. So that's how I know how to cook, so that I don't have to ask Priya.
Sorry?
I don't have to ask Priya.
Ask Priya. Oh, sorry, I missed that. Sorry.
There was a research study I was involved in Stanford. When the fiber intake was very high, the collagen production was also increased. This was in animal models. But there is a direct correlation. Direct correlation. So between the gut and the skin. See, another biggest question is glutathione. Is it a fad or is it really help?
I feel sad and bad for glutathione actually, and for dermats also, because glutathione is becoming one of the most abused term and has been misleading, and many people have been cheated with glutathione supplements or injections, because it is a master super antioxidant that actually works, but it will work in a certain way, right? If you take only oral glutathione but you're not following any other skincare steps, it is not going to.
Is that right?
It also works for people who have that kind of oxidative stress, free radical damage that's going on. It won't work equal for everybody also, to be honest. And also, if you're taking IV glutathione, you have to take it for a long period of time for you to have benefits and to continue to have benefits. Once you stop the IV glutathione, the results are also going to be within 1 month or so, the results are going to fade off.
So two medical points on that. One is, glutathione was not invented for decreasing a tanning. It was invented as an antioxidant for other medical purposes.
Cancer treatments. Yes.
So, as you know, when they treat cancer patients, the cancer patients started glowing.
Yes.
That is how they thought, glutathione can be used for this.
That's exactly my point. So you please tell doc how many sessions are these cancer patients are on.
Correct.
How many times they have to keep taking this for them to see that glow. That's the point what we are trying to make, is that it's not a quick fix. It takes time for you to see results with IV glutathione. And so it is okay for you to do it during your wedding or some big day, or as a wellness thing. Like a lot of times we do IV drips as wellness drips also. But have that vision. Like, don't expect quick fixes. And don't shame our glutathione. It's good, but don't misuse it also.
Natural source of glutathione? Not that much.
It's like any antioxidant rich food. Nothing specific with glutathione, but any antioxidant rich food, your berries.
Blueberries.
They're all like, they do similar thing like fighting the free radical damage, but in different ways.
In different ways. Polyphenols is the most important thing. See, as I said, I have a lot of questions for you.
I know, that's what we thought 1 hour, but then you're like, we have not come to the main.
So, most of my patients also deal with psoriasis.
Oh, yeah.
Because whenever there's a gut problem, some other autoimmune disease is coexistent somehow. It could be lichen planus, it could be psoriasis.
Yeah.
So tell me, how does a patient know that, okay, he's developing psoriasis? Symptoms. Is it like dry flakes?
Psoriasis is a loud disease. There is no two ways doubting that whether I have it or not.
I
right?
see.
I would start off by saying this, that psoriasis is highly misunderstood. People do the biggest mistake of treating psoriasis as just a skin condition. For me, I take pride. That's why I said thank you for bringing this, because I take pride in treating my psoriasis patients with just dietary and lifestyle changes. I hardly give medications to my psoriasis patients. Yes, it might take a little longer time to give results, but that gives sustained results, and relapses are very low. And even if the relapse come, it's not as strong as previous
before.
relapses. And it can be easily managed with just topical chemicals and diet. So psoriasis, like you were asking, doc, it comes as thick plaques, red thick plaques onto the skin. It's itchy in most scenarios, and it's very uncomfortable to the patients, right? It can come anywhere on the body, scalp to toe. It can affect any part of your body.
Most common?
Most common we see the truncal area.
Truncal
Scalp
area.
is also very common, but truncal area is the most
Abdomen.
commonest. Abdomen, back, hands. It can happen anywhere.
Anywhere.
But yeah, like you said, most commonest is the truncal area.
So they come with psoriasis treatment, or they come and say, okay, what is this diagnosis?
Most of them come saying it is psoriasis. Because also by then they would have already been diagnosed with psoriasis. Multiple times.
Okay.
And if they're bringing their children, they know it is psoriasis because they had psoriasis, as a child or even
before.
as parents. They know that most likely it's very rare that what is this with psoriasis happening. That's why I said it's well aware already.
Okay.
But what they're not aware is what is causing it. And once we try to fix that, it is a life-changing exercise that we do. So psoriasis, like I said, it's not just about skin, right? It starts with gut. For me, most of the psoriasis is because of gut issues, the leaky gut. And then adding on to that will come your stress. Stress, boom, psoriasis, right? And then you see lack of sleep, the gut issues we covered with diet, right? Sleep, stress is the most important factor. Sometimes we see that psoriasis as a first episode triggers after you get some upper respiratory tract infection or you fall sick and then you're recovering and then you suddenly get, because your immunity is going down and the autoimmunity kicks in and then you start to get your psoriasis. But now I want to ask you this. We know this leaky gut is the problem, right? Do you want to throw some light upon why leaky gut happens and what happens for this kind of inflammatory conditions to kick in?
So as you know, there are lots of immune cells lining the intestine, mainly in the terminal part of the small intestine. And what we have seen is that whenever there is a disturbance in the lining of the gut, it could be anything. It could be stress, it could be lack of fiber, it could be lack of fermented food. These immune cells will not start working properly.
Right.
Will not start working. So then the immune cells create this cascade that your body doesn't belong to you.
Yeah.
And it starts eating up your own body, basically. So as a gastroenterologist, I see a lot of ulcerative colitis, Crohn's disease, where they eat up your own colon, large intestine, thinking that it doesn't belong to you. But more commonly, psoriasis is almost the same thing, where it reaches the deeper layers of the skin and then telling you that, okay, see, your gut is not right.
Not right. So I have a very strict diet policy. We give the diet charts to the patients. We also had a program. Now it's becoming overwhelming for us to do all this, so we've taken a break from that. We had a program called DNA 360, wherein we had a nutritionist, we had a gynecologist. So it's a multidisciplinary bench we had, and we used to guide our patients accordingly. So after me, they used to go to the dietitian, understand, work with them, do all the tests that's necessary. So we used to curate the entire program for them. So first thing is diet. So we have a very strict diet chart where we say no to certain foods. Irrespective of whether it's suiting you or not, there are some foods that are blanket no. And then the stress management becomes very, very important. Like I said, we clearly see CS walking into the clinic in July, June, post the closure. They've gone through late night work, very heavy, stressful work, and they come with psoriatic flares, students after their exams.
Stress worsens the psoriasis.
Direct correlation. You can just see instant flare-ups, like in a month or two. Stress and then poor sleep cycle, smoking, again worsens your psoriasis. So these are the corrective lifestyle choices. Then something as minor as taking extreme hot water bath, taking long showers will again cause stripping your skin of its natural barrier, transepidermal water loss.
What is the thing with the hot water baths? What does it do to the skin?
Oh, we all love it. It's very relaxing, but it is causing dehydration. It is stripping your skin of the barrier, and then it is causing a lot of transepidermal water loss. Your pores are more dilated. You tend to lose a lot of water. Do you feel this when you take very hot water bath? You feel like scratching your back, and it's a very relaxing feeling.
Yes.
That's because of histamine release. And we don't want that in our eczemas or psoriatic patients. No, because we have a lot of it already. Why do you want to further trigger it? So absolutely no hot water. For them, it is cold water or lukewarm water bath. Extreme cold is also not necessary, just lukewarm. That much is enough. Wearing skin-friendly fabrics, wearing only loose cotton clothing. Avoid any synthetic rayon, nylon fabrics at all costs, because it causes static, irritating the skin, not just letting it be comfortable. So these are the minor changes that we also look into.
Right. I see a lot of patients with GI problems coming down to my clinic who are night shift workers and also having psoriasis problems.
Direct correlation.
So, sleep is a problem. But whenever there is a stressful period, again, the brain-gut axis connection is not good. So, again, the immune cells are at disadvantage.
Yeah.
So, then the flare-up is coming. So, you'll not believe every time they come and see me, the next appointment is dermatology. All the time.
Yeah.
All the time.
Yeah.
So it makes a huge correlation over there. The repair hormones, your growth hormones and all your reparative hormones are secreted more based on the circadian rhythm
Correct.
during the last phase of the REM cycle. So each REM cycle is 90 minutes. So you need to have minimum of 5 to 6 REM cycles. So just based on circadian rhythm itself, if you want that final push, it needs to be that 5th or 6th REM cycle. You will not get it if it is less than 6 hours. So that is the angle. Yes, some people say that, yes, I don't need 7 hours of sleep. I just need 6 hours of sleep. That is, it is not reflecting on your body as of now.
Okay.
Maybe you are even more productive if you get
because
that
you're young and your body is able to take it, so it is
correct.
doing. But as you grow older, I think it makes sense. Yeah.
Yes.
Yeah, but I'm more particular about the time. I would say please make yourself put yourself to sleep by 9:30, 10. That is non-negotiable. Turn off your lights. I know it is very very difficult for many people. So 9:30, your lights must go off. You should calm yourself down before sleeping, unwind yourself, and then sleep by 10.
That's normal for any skin patient, right? Anybody.
Everybody, but all the more important for people with autoimmune disorders like psoriasis. It's much more important.
And that is because the melatonin secretion.
Melatonin secretions plays a huge role, especially with your hair. Overall skin health also. Again, circadian plays a role in when it is secreted, how much it is secreted. Now people are like, okay, I'll take melatonin supplements.
Yeah.
That is come, but nothing better than your body naturally repairing itself. So sleep time is very important. Okay, I'll sleep for 7 hours, doc, but one day at 12 o'clock, one day at 10, one day. You're messing up with the circadian rhythm.
Correct.
So these are some non-negotiables when it comes to psoriasis. Sleep, diet, most important thing. And what did we cover? Diet, sleep, stress management.
Correct.
If it can be managed.
Good. And then Dr. Priyanka.
Yeah, because Dr. Priyanka will give you all this and less of medications. And Dr. Pal also, who will, through new me, I think will help you.
From the melatonin, we are going to the hair aspect.
Yeah.
Okay. So,
biggest caseload again.
Right? Yeah. Melatonin plays a role in hair maintaining the quality.
Yeah, it does.
Right?
But it's not the only hormone.
It's not the only hormone. So is it fair to say that late night sleeping will decrease the hair work that you're planning to do?
Of course. See, the thing is, when you sleep late night, it's not that, okay, you sleep late night, so your hair will shed. It's not that. It's an indirect cascade again. So when you sleep late, you wake up not feeling good. Again, your body is not repaired well. So it shows its effect on every department of your body. It's not just hair. Your skin doesn't glow. You don't feel energetic. And your hair will suffer. And hair and skin, especially the hair, is the first external expresses of your internal health. You do it once in a while, no problem. That 80-20 rule applies everywhere, right? In most segments. So once in a while, you're going for like once in a month, I went out to a party and I slept late, I ate bad. It is okay. The next day, you make sure that you don't you sort of repair the damage that you've done in the past weekend or whatever. So once in a while, it's okay. But when you do it on a chronic basis, it's definitely going to play a huge role.
And you are seeing early balding more commonly these days.
Balding was an issue like at your 40s or 50s at some point. I've seen my dad go bald in his 40s, started to around in 40s. Grandfather.
And you're talking about androgenic alopecia, where the Mickey Mouse pattern.
Yeah, exactly. It's a pattern baldness. So it was a problem in 40s and 50s, but now you see as young as teenagers coming with balding. Teenagers.
Mainly boys.
Androgenic alopecia is mostly a boy problem. It is there even in females. Female pattern thinning is also there, but it is much more significant in a male because the androgen receptors are such and the effect of the hormones is such that it is mostly for men. Some departments we were spared. Okay. So this is one such thing, but also like few women also have female pattern thinning, but it's not as aggressive as we see in men. So it is that. So we see teenagers coming with balding now. Again, it's not just with balding. Every disease, even diabetes, you see is creeping on to people much early. This is because of change in our
the
environmental
lifestyle.
and our lifestyle, all of that. So everything is coming very early. Initially, I used to be surprised, 18-year-old. How I'm like, okay. It's come to that now. It's become very common. People are getting hair transplantations in their 20s.
The 20s. Wow.
Yeah, that too when we ask, we have to make sure that they wait for some time, because now people are coming in 20s and, doc, I want to do my hair transplant. I said, no, just wait, because this is a progressive condition. We'll have to wait. We'll have to treat with other other modalities first, and then probably get into HT. We don't dive into HT right away. So balding we see much early, again owing to the lifestyle factors and genetic factors also, that it is coming on very early. We definitely see that hair
Genetics play a role.
is the main role. It is the role. Unless you have genetically predisposed receptors that are attracting this DHT and attacking the follicles, you will not go bald. If at all, see, there are different things, doc. You have hair thinning, that is the balding or male pattern baldness, female pattern baldness. It's pattern, it's genetic, your hormones are attacking your hair and progressively killing it, causing it miniaturization. So they slowly become thinner and finer, and then they become like the small vellus hair, and then the patches grow bald. And then you have hair fall, which is telogen effluvium. Wherein you see your hair is shedding everywhere, like nobody's business, on your pillows, on your floor, everywhere, and it's causing a mess. So that is hair fall, telogen effluvium. That is because either you're recovering from some fever like virals, and then you see after 1 or 2 months your hair is shedding a lot. You have some vitamin deficiencies, your hair sheds. Late night sleep, stress, all of these factors are causing this. And once the root cause is fixed, the problem stops. So it is a temporary problem. But hair thinning is a progressive condition. No matter what you do, it progresses. And then you have hair breakage. The quality of hair is not good. Maybe you're getting exposed to too much of dust pollution, the hair is becoming dry and it's breaking. You're doing too much of heat styling, your hair is breaking. You have some deficiencies, your hair is breaking. So hair breakage is a problem. And then we have hair diseases. Like you have alopecia areata, the coin-sized patches that go, and folliculitis. These are all like niche subject, or not very common to everybody.
Is there any way that when should we come and see a dermatologist when there is a hair thinning?
Immediately. With hair, immediately.
As soon as possible.
Immediately, as soon as possible. Fix the next appointment possible. Why? Because like I was just saying, hair thinning especially is a progressive condition. The more you delay, the higher the chance of some amount of hair follicles being permanently lost. Because it's a very slow process, especially for men. It goes in, there are the stages. Stage of like, enakku one agadu. Balding me, no way. And then they say, no, but I can see bald patches. No. And then they come to a stage of like fear, like, yeah, I think I'm getting it. I'm getting it. And then they go into a cycle of depression, and then the acceptance. So they go through all these emotional roller coaster, especially men, because it is one of the most prominent aesthetic features for them.
That's the only thing.
It's the only thing. Even for women, but men, because this is the main concern. Right? Addressing it at the earliest, we will be able to block the attack to some extent. So now we know that it is genetic, but what are the other factors? If you ask, any lifestyle factors that is not good for your body is not good for your hair. Smoking, stress, sleep, a little bit of bad hair care choices.
Collagen.
It will just add on. I wouldn't put it as a top thing, but everything adds on to it. Yeah, but not the top. Top again is your sleep, stress, smoking, a heavy factor again. These are some of the things that will add on to your problem. So now in the beginning stage, when your hair is still getting thinner and finer, but the blood circulation is still intact, then you add ingredients like minoxidil that will help. It's a vasodilator, right? Again, that is also primarily not.
So minoxidil helps in preventing hair loss.
Okay, let me put it this way. Finasteride helps in stopping or pausing the process, while minoxidil helps in regaining the regrowth of the hair and making it reversed.
I see.
Minoxidil cannot stop the process.
I see.
Finasteride can. Finasteride is a drug most feared.
Yes.
Whenever you say, but doc, I don't want finasteride. Why? Because they think that it can cause erectile dysfunction. Yes. They think it can cause...
So the side effect of finasteride
is sexual dysfunction problem, which nobody wants, which we don't want for our patients, right? So when we put finasteride, it's not that, if he gets erectile dysfunction, it's okay, but I want to save his hair. No doctor will do that. So we know why we are putting a drug, right? So, but doc, I don't want finasteride, cause this causes it. First discuss with us whether it causes. Why did it come to that conclusion? So minoxidil, yes, it is
for finasteride, what is the percentage?
1 milligram per day.
The dosage is 1 milligram. What is the percentage of patients may get ED?
Under 3%.
3%.
I think the last data that I remember is about 3.8% of people can end up getting this. But I will tell you why also is that. So it what it does is it blocks the conversion of testosterone to dihydrotestosterone.
Correct.
And dihydrotestosterone is the one that is causing the hair thinning.
Correct.
So this process is blocked, and it's a selective 5-alpha reductase blocker. It is selective blocking. It doesn't randomly block. It
Correct.
selectively blocks. So by doing that, it is reducing the dihydrotestosterone levels on your scalp and the serum also significantly by up to 60 to 70%. It's huge. But there is some percentage that is still there because ultimately genetics is the boss. He's the mystery boss.
Okay.
We can't do anything too much to him. We can just do our fooling around and do whatever, but you can't shake this genetics. So it will still do what it has to do. That is why I call it as a progressive concern. But when you do these things, you can add more life to your hair, right? So now you're giving this finasteride. It's blocking the dihydrotestosterone. So the attack is reduced, right? Now attack is reduced. But what about the hair that has already become weak? Minoxidil is going to pump in more blood to your hair, making it more stronger, reversing the thickness of your hair, and just keeping that hair healthy and happy. So you are adding life to your hair with minoxidil and finasteride. Now additionally, when the hair, it's like, a person is so sick that they're on the resuscitation bed, you do everything to resuscitate the patient and then reduce the intensity of whatever you're doing, right? So similarly, when person comes with high grades of balding, when there's a lot of thinning, then minoxidil finasteride is just not enough. We add GFC or growth factor treatments, PRPs. PRP is very, I don't do PRPs anymore because GFC is proven to be much more effective, less painful than PRP. It is slightly more expensive, but it's worth that expense.
GFC is growth factor concentrate.
PRP is we take your blood, we spin it, we inject the platelets. But in GFC, there is already some other synthetic growth factors that are also added in this that will kill the unnecessary substances from PRP, thereby making it less painful. Like there are this unnecessary red blood cells and few white blood cells that are not needed. That creates that inflammation and pain when we inject. That is all taken care of with GFC. Plus, it is a little bit more potent. It is proven, for me also in my practice, we've done comparative studies and then we stopped doing PRP unless a patient can't really afford. And sometimes we end up doing, but it's very hard because we try to help the patients from our end also if we know that it is really a genuine case. Because it's not just about aesthetics, doc. I tell you, it kills the confidence of patients.
Yeah, it does.
A lot of times it hurts. One thing that it hurts about people when they talk about dermatology, just to be as vanity. They don't understand the emotional burden patients carry with acne, balding. We know the pain. And when we are able to give the confidence to the patient, that is the reward that we get in our field. Anyway, you can put the music to this bit and put it like some emotional story pain of a dermatologist.
No, I can relate to this because I had very significant hair thinning. And then I did topical minoxidil and oral finasteride. Didn't have any side effects, and the minoxidil you need to continue for a long time, correct?
It is,
lifelong, pretty
lifelong.
much.
Once you say that, okay, I'm done, I don't want any more hair, then you stop. But all of us, even on our deathbed, we want to flaunt lustrous thick hair, flawless skin, and then die in peace. So minoxidil pretty much is like your day-to-day. Yeah, so we also add GFC. Because we need that additional nutrition. We want to do everything to make sure that this hair is regained.
I see.
Yeah, so we do GFC. We add other supplements also. And more often than not, when we do blood tests, these guys are deficient with something or the other, vitamin D, or especially with females, iron deficiency anemia is a huge factor that will add on to the thinning also.
Correct.
And hair fall, hair breakage, dry hair, brittle hair, everything comes with iron deficiency. And most Indian women are deficient in this department. So we need to give them the diet and all that counseling. So we do all of this. 6 months is enough for us to know how much of it is regained, and that is what we will regain. In 6 months, we will know how much result we can get, and we got. And then we slowly taper these things, but minoxidil and finasteride are going to stay.
I see.
Now, what about the side effects? It's far and few. I have not seen anybody on having the side effects with finasteride in all my years of practice. my husband is on finasteride, minoxidil, GFC, whatever I'm telling you now. He's been taking all of that for the longest time. And we closely monitor. We do their liver function tests. We examine their breast. We talk to the patients about the symptoms, that if they're facing anything. And if at all we find there is any problem, we stop the medication. And it is temporary and transient, which means you stop the medication, the side effects are gone. There is no permanent damage that can happen.
But the outcome is pretty good, right?
Absolutely. Again, I'm saying it's a progressive condition. We cannot stop it 100%, but up to 60-70% improvement you will have. And when you take it consistently, your hair will, most of it will stick
We'll
with
stick
you.
to I think that's what happened with me. I think topical minoxidil.
Yeah, you should better probably share your experience. So these minoxidil, sometimes it can have headaches, irritation on your scalp. Again, we reduce the dose, make it alternate nights. We do all that stuff, and when nothing is working is when we stop. But without minoxidil and finasteride, it's very difficult for us to treat male pattern balding. I'm not talking about hair fall. Hair fall we can do without all these also. We can just give some peptide-based serums, like you have Redensils, Procapils. We can give peptide-based hair serums. We can give supplements. Correct the root cause first. Turn off that leaky tap.
Correct.
And then this will set. But with hair thinning, please understand, because they don't understand this in the beginning. After 5 years, 4 years, they come with bald.
Exactly.
The donor area is also not good. We might not be able to do a successful hair transplantation. But also you should understand that hair is a limited resource. People think that, okay, it's okay, when I lose everything, I'll get a hair transplantation done. You will never get the density you have. Because we are only going to take some follicles from here and implant it here. So it's just hair reorientation procedure. Right? We are not buying hair from somewhere else and putting. So even if you have all the money in the world, it is your hair that we are going to use if you want to have a natural hair transplantation. Otherwise, you can have wigs, hair patches, all of that is there. But if you want natural looking hair, it is hair transplantation. There are only two ways, Doc. I say there are only two things you should do here. One is go all in. Be at it, keep doing it, be consistent. Or two, just be okay with balding. And rock your bald look. There are so many guys who are rocking bald look who look fantastic. Rock it. Then don't know headaches only. But don't do this hanky-panky half business. Okay, I'll just do minoxidil, I don't want to do finasteride. Okay, I'll just do GFC, but I don't want to do any topicals. It won't work.
I see. So what about hair gummies?
Don't buy into it.
Don't buy into it.
Because, see, with hair gummies, it is something that is in a chewable format. So when something is being chewed, they also want to make it palatable. It has to be nice to chew, right? So then they add a lot of additives, sugars, colors, and the dose of the active is very less. And mostly it is just biotin. Gummies are just mostly biotin, and they add other vitamins also, but it's mostly biotin. And that, first of all, it works only if you're biotin deficient. So first of all, again, biotin supplements for hair works only for people if you're just biotin sufficient. But who is only biotin sufficient? There are other causes for your hair fall and thinning.
You check biotin levels? No.
Not really. No, not really. And again, we never give one solo supplement as such, because now it is all about multiple deficiencies. Nobody has the nutrition in the food they are eating, right? Pollution. So we want to give antioxidants. We want to give multiple vitamins and minerals that will help making sure that the hair stays in place and grows healthy. Gummies are there for, it is just, I don't know. I think I should be banned product only already. Because it is the optimum dose is not right, first of all. You will not be able to get the exact dose. And there's a lot of, even if they say no sugar, there's some additive sugar. Otherwise, it's not tasty. It's not palatable. So to make that, it is that instead of that, just take a tablet which has come with definitive dose in the dosage that it works. That's very, very important.
Like 5,000 micrograms, or what is the dose of biotin?
It depends on each of the things. So in gummies, it says only 2,000, 2,500. But in tablet forms, you have 5,000 to 10,000 units also. So that again, it depends on a lot of factors with what all you're pairing it with. Because we never give biotin as a solo supplement.
You never give biotin as a solo supplement. But it's a huge market in the US.
It's a huge market. That's what I'm saying. It works only if you're only biotin deficient.
That doesn't happen. So your recommendation is take a multivitamin which has biotin in it.
Yeah. Multivitamin, which should be curated in such a way that they are not counterproductive. They are not fighting against each other. All the vitamins that you're giving should be helping each other to perform better. So that is a very curated list of products that we have. That's why you should not be taking supplements at any cost by yourself. I myself don't take supplements which are not in the skin and hair genre by myself. You should always consult. You should get your blood work done at periodic intervals. Your hair fall could be because of vitamin D deficiency. Like we already discussed. So you need to know what is causing it and take that appropriate supplementation. And if you're also somebody who has a lot of oxidative stress, poor lifestyle, then you should be taking like a You have kits that are coming now, which is skin kit, hair kits that will help you get everything that you need in that capsule. On top of that, if you're heavily deficient with something, we add that particular ingredient. But otherwise, it is the kits that we tend to give, and we do the blood evaluation and then see if the person needs it. We also do cyclical supplementation. It's not the same thing all the time. So vitamin D is not something that you take year long, right? So we do the cyclical supplementation.
We read a study which says that if you take 2 to 3 fruits of different colors per day, you don't need a multivitamin.
Again, it depends on which vitamin we are talking about, no, doc? Like if you are relying only on food for vitamin D, it might not work.
Yeah. So if you're vitamin D deficient, then it is very clear that just with, and if you're a vegetarian, then just with dietary food supplementation, you're not going
how
to
much of
replenish.
sun you sit also, it's not
Sun
going
is
to
also
give
will
you,
not increase
because
that
that is
much.
also going to give you more problem. Now with UV damage and pollution, you're going to get more damage than this.
One question I had about sun exposure. Vitamin D, they say usually 10 a.m. to 2 p.m.
3.
3. But and then that should be without sunscreen.
You can apply sunscreen to the parts that you want to safeguard, like your face, neck, palms, and you can expose the rest of your body. That is good enough. But the problem now is the pollution. When you're sitting there for 20 to 30 minutes is the ideal duration.
Correct.
During this time. So, like, you can apply a little bit of coconut oil that can help with deeper penetration. We give this as a therapy for our psoriasis patients. We ask them to apply a combination oil. There's an Ayurvedic mix that we get, which has lots of herbs and various oils and concoction that helps in deeper penetration of the UVB rays. That helps with regulating the keratinization process. So it helps in healing the psoriasis patients. So that is what we tell them. But the same thing if you do, my dear friend, you're going to get terribly tanned. You're going to get premature aging on a daily basis. So that is the problem. So how many of us are willing to go to the terrace during that time, expose the body for like 20-30 minutes? I don't think it is ideal
Correct.
for many people. Olden days, farmers, they had most of their body exposed, so they were not as much deficient, but you can also see premature aging, fine lines, wrinkles on all of them also, just that they were not as aesthetically oriented as you are at this point.
Why should we do sunscreen now, but when the ancestors did not do it before?
So your grandparents didn't have Wi-Fi. They were not relying on screen time. They were not like, their faces were not into the phone all the time. They didn't have apps to keep them busy. They were not exposed to blue light for 10 to 12 hours of work shift like you guys have. They did not have the level of pollution. They had a lot of nutrition in the food they ate. They didn't have so many things to stress about like how we are stressing about every single thing now. Primarily, they were not so aesthetically conscious like how we are. And at that point of time, a 40-year-old looked like a 40-year-old or a 50-year-old. Nowadays, no 40-year-old looks like a 40-year-old. They're all looking much younger. If whoever is taking care of their body, that is what I'm trying to say. So please do not compare the times when the things were very different to now, right? Environmentally, nutritionally, societal norms of beauty, availability of products is very different. Okay, there were so many things that were used because it's easily available as a grooming thing. Turmeric was applied, coconut oil was applied because they didn't have better options at that point. From whatever we had, we did the best we could. They were okay for that time and age. But now you have more aesthetically acceptable products. Now you tell me who, I will dare most of the parents to send their kids with oil in their head to school. We were like till 10th, 12th grade, putting 2 chotis, so much oil with a ribbon and yes, okay, mama, and going. Who will apply that now? Tell me. So now oiling has come down to 1 to 2 hours before. And even now that also most people don't like. So we have conditioners that will still take care of conditioning aspect that coconut oil used to do. So conditioners are there which are much more aesthetically acceptable and safe also. So things have changed, times have changed. So even now nobody is saying you must do skincare. If you want to, basic health of the skin can be maintained with just the 3 products like we discussed. But if you want to do beyond that, please free to use skincare. If you don't want to do that also, if somebody says, I don't want to do sunscreen now, what? Nothing will happen. You will just age prematurely, you'll have pigmentation. You're not going to die because of that. So please go ahead and don't do it.
So some myth busting segment.
Yeah.
Toothpaste reducing pimples. Yes, no.
Paste reducing, the menthol, the fluoride in the toothpaste can actually cause dark spots, irritate the skin and cause dark spots. It will reduce the pimple, but it will leave you a dark spot, which is better. It will irritate your skin for sure, not at all good. Leave it to your teeth. And even like we say, when you wash, some people who have concerns of pigmentation, we tell them please wash after brushing. There are some foam remnants around, they will not wash it properly. So that will also cause pigmentation, especially in children. Then please rinse your mouth thoroughly. Make sure that there's no remnant anywhere in the corners of your mouth also, because that can trigger pigmentation.
Oily food causing acne.
No direct correlation as much as we have with milk, sugar. Oily food, fried food has no direct correlation. But when you eat anything that is unhealthy consistently, it will cause inflammation and thereby causing your acne, not directly. It's not sebogenic as such.
I've seen many patients with mango and curd rice.
That is insulin spikes, no? Mango. That is sweet, sugar, direct. That because we don't eat with one. Who eat one piece of mango? And no one can have just one. Is not for less for Indians. It is mango.
Mango. What do they say? Ice dump to close the pores.
Dr. Pal, I am seeing you struggling to get all Gen Z things into this ice dunk. Okay,
To close the...
It causes immediate constriction of the pores and it causes that sudden blood gush. So therefore, it gives you that instant fresh look and constricted pores, but it is only temporary.
What are you talking about Gen Z? I am at home.
You are you
We are
have.
saying at home.
Oh, correct.
She did a reel where she put her face on the ice. So it gives a temporary...
It's very temporary. But then if you do too much, it can actually sensitize your skin. There are people who put their face in the ice for a long time. That can cause ice burns and cause skin sensitivity. So if you're doing it as a refreshing thing and you feel good about it, you do it.
Okay, super. And then the other...
This is one trend I'm okay with at least.
Another common complaint is that when you prescribe something, only when it causes tingling, they think it is work.
Sometimes yes, but by and large no. By and large no, because it is causing barrier disruption and irritating your skin, and hence you're feeling that. But some ingredients do cause the tingling. Now there are some things which has micro needles in it that causes instant tingling when you apply and it settles down. But majority of the times no.
Other thing is skin routine is not for men, it's only for women.
So what do men have? No skin?
Only hair.
No, you don't have skin.
We do also have skin.
So then it is a skincare for everybody. It is unisex. It is from the time you breathe to the time you die. You have to take care of your body as a holistic unit. It means your hair, your skin, your food, your sleep, everything is together. Men, women, child, tata, ajja, ajji, everybody has to take care of their skin. Just that because of structural changes of skin in men and women, men age slightly better and they have more oil, so they might not need moisturizers, they might not need all of these things. But that's also reason why you get more stronger, acne and stronger scars. But by and large, you guys age slightly better and you take things for granted when it comes to the skin. So you think you don't need it. But also like societal norms and silent expectations of women, not silent, it's pretty loud expectation that women have to...
No, silent expectations for men now.
It's for men. Yeah, exactly. So the expectation that women are to be more groomed, women are to look a certain way. So that is adding to it. But now I think day by day, I see that in my OP, I see more and more men are coming. And men are not coming with just active concerns. They're coming to just...
To maintain
a good skin and say, I don't know anything about skincare, doc, please set up a skincare routine. Then I say, good that you've come. I'm going to start you with just 1 or 2 products. I'm not going to put you like a proper, I'll just give you something basic. You please start with this. If you successfully do this for a month is then when we go to addressing the concerns. First you start off with this.
I'm so glad that I didn't have to meet the silent expectation. I got married soon.
She's taking care of it every day, I'm sure. But also like when I think you would have seen huge change in your skin.
Yes.
Because of 2 things. One, of course, your wife Priya, who is very like behind you, which is very good for you. But also with the changes you've done in your diet and lifestyle.
Yes.
The gut. I think once you started your transforming your gut health, your skin is automatically...
And also my hair.
Of course.
My hair fall actually got controlled mainly after I lost excess fat.
Excess
fat. Last segment is rapid fire.
Oh, okay.
Okay, all right. One is just fast. Within a second.
Faster than what I was already. Then people will not understand, Dr. Pal, what I'm saying. Okay, fast.
Yeah, super fast.
Super fast, okay.
Have you ever rejected a patient who wanted unrealistic skin perfection?
Many times. It's a day-to-day thing, especially with fillers. Procedural expectations. Scars is one big segment where they want flawless skin. Super fast, no? All the time.
And you said no?
I'll say no.
You'll say no, okay.
Especially fillers, though, I reject left, right and center.
Okay. If applying a face mask or sunscreen gives you a superpower, what superpower do you prefer?
To look ageless, fit and fine all the time, with Netflix binging. I want to do that, and still the gut and skin should be taken care.
Okay, number 3 is overrated skincare product.
Can I say the whole K-beauty thing is overrated? The whole K-beauty thing. Whatever product in that you want to mention, please put it there. The snail mucins and all are highly overrated.
Korean glass skin. Okay.
Not just glass skin. Korean products in general for Indian skin are overrated.
Underrated skincare product.
I would want to say a moisturizer, but I see that many people are picking up now and doing moisturizers. So now in the current times, I would say chemical exfoliation. It's highly underrated. A part of this. I'm not saying a product as such. It's the category that as a chemical exfoliants, not many people are doing it, and hence they don't see a lot of results in their skincare.
Chemical exfoliations on the face?
Anywhere on the body, face, wherever. So what happens is when you do chemical exfoliation, it is unclogging your pores, taking away the dead skin cells, so giving you that better texture, taking care of very superficial pigmentation, plus every other product you're putting after that is penetrating better, deeper, and acting better. So giving you better results. Otherwise, it's like you're wearing a raincoat and standing under rain. You're not going to get wet. So if you have lots of dead skin cells and follicles, plugs that are blocking your pores, whatever you're putting is not going in well enough to give you results. So then you see that my skin is always feeling uneven skin toned. It doesn't glow because you have a layer like the dead skin cells that are blocking and not giving the proper light reflection. So once you chemically exfoliate on regular basis, you will see the difference.
What skincare mistake does Dr. Priyanka herself make?
Taking bath with hot water. Guilty as charged. Yes. I try my best to avoid most days, failing at it.
No problem. What's the one product you couldn't live without in a desert? Sunscreen, facial cleanser, hair lotion, water.
Desert water.
Hydration itself will...
The cleanser bhi nahi chahiye. You just put that water, your face is cleansed. But if possible, I'll request for a moisturizer. Dry skin, no?
Dry skin. If you could predict the next big skincare trend, what would be?
I think skin minimalism. Gone are the days of 10-step routines, 5-step routines. Now people are understanding and preventive care, both. People are wanting to do more of prevention. They're coming and asking for skincare routine, which is a huge change. Before it was for concerns that they used to come to fix it or aesthetic enhancements. But now it is more about, I don't have any concern, doc. I just want to get a good skincare routine, and I'm so happy when somebody says that. That is that. And skin minimalism. Now people also have understood that we should not be using too many products. Some segment of people have understood. But it will get there.
Super. And last question. One celebrity you would love to treat?
Dr. Pal.
No, celebrity.
You are a celebrity. You are a celebrity. You make our medical fraternity very, very proud. We are so happy with and you bring so much joy to all of us. It's not just medical information. It's infotainment, which I think all of us need. We need information, but packaged in such a way that it reaches people, right? That's very, very important. And it brings joy to see how energetic, joyfully you spread the information. That energy passes on. So you are a big celebrity.
Thank you. I will come, but not bring my wife.
I would love to treat you taking permission of your wife.
Wonderful, wonderful. I could see myself in you. You're so bubbly.
We should have recorded our chatting like two. I just felt like I'm chatting to some school friend.
Right. 2 hours of information packed as much as possible.
To us?
No. If you keep talking, you'll talk for even 3-4 hours. That much amount of information that you have.
I actually came with set of questions that I wanted to ask you, but maybe next time.
We'll do next time. It was a wonderful, wonderful presentation. Thank you so much.
Thank you so much. Thank you. I hope this helps our audience.
Of course it will. Of course. Thank you.